Some of the sharpest opposition to the health care bill put forward by the Republicans came from governors both Republican and Democrat alike. Over the weekend, top health care officials and Vice President Mike Pence, they lobbied over at the National Governors Association meeting up in Rhode Island. The administration was trying to convince governors that changes in federal funding would not actually translate into cuts at the state level. I want to bring in one key governor, Arkansas Republican Asa Hutchinson, who's joining us right now. Governor, thanks so much for joining us.
Great to be with you, Wolf.
You expressed, Governor, deep concerns over the Senate Republican health care bill. Was your opposition based on possible cuts to Medicaid and how that would impact folks in Arkansas?
Well, it was based upon a shift of cost to the states. We can do reform. We can have cost-saving measures that will help the federal government, the government. But what the last plan was too heavy of a shift of cost to the states that we could not absorb without having significant changes and cutbacks. And so, I met with the vice president, our senators. They really accomplished some very substantive changes in the last version of the Senate bill that I asked for. They were moving in the right direction, but I was still concerned about the cost shift. And now we see the news that they're not going to be able to go forward. From a state perspective, we're accomplishing reform in our state. We're trying to control costs that helps the federal government and the state government. We're trying to assure access in an affordable way, but not create dependency. Those are the reform measures that we'll continue with, regardless of what happens in Washington. But from a national perspective and from a practical perspective, what we have nationally is not working, and I hope they can continue the change in the fight for changing the status quo.
You heard the Trump administration's arguments, and you heard them directly from the vice president who was at that governor's meeting in Rhode Island, that funding changes wouldn't amount to actual cuts at the state level that could impact you as a governor of a state. But why didn't the governors, Democratic governors and Republican governors, buy that argument?
Well, actually, it merits a lot more study. Whenever you look at not just the Medicaid funding, but they created a stabilization fund that I think it was over $400 billion that was being placed into it. Those are funds that they make the point of that we could access to make sure that we're covering those that might not be able to sustain or they need more support on the health insurance market or in wraparound services. So that's something that needed more study, but the bottom line is it was still a very significant reduction in the growth of Medicaid, and let me emphasize it's the growth of Medicaid spending. They're reducing that. We will share that, but it was really too sharp, and it would result in the states having to pick up too much of that burden.
Here's what the Speaker of the House, Paul Ryan, said about the consequences of leaving Obamacare in place. Listen to this.
Well, I'm worried that Obamacare will stand and the law will continue to collapse and people will get hurt in the process.
So what happens to health care, the insurance marketplace in your state, Arkansas, for example, if as it looks like will be the case, the Affordable Care Act stays in place?
Well, the problem with the Affordable Care Act staying in place from an Arkansas perspective is that we're having to continually go to the federal government for the reforms that we need and get their permission. And while the Trump administration leans forward a great deal more, we're still not able to put into place the effective responsibility requirements, the cost-saving measures, and have the flexibility. Rules are changed in Washington under the law, and we have to live with those. So that system needs to change. In terms of the marketplace, it is working, it's functioning here because we have a unique solution. We have, instead of spending Medicaid dollars on Medicaid, we're actually spending those in the private marketplace, and that reform is giving more stability to that market. But you've got to look at it from a national perspective as well. Right now, the Affordable Care Act is leading us down a path of too much cost, too much growth in Medicaid, and that impacts the states as well. And so overall, we will participate in savings and in reform, but they need to be able to change the direction from Washington, and that includes
right.
repeal and reform and change the Affordable Care Act.
So over the past few hours, the president has come up with two solutions now that it's failed in the Senate. Last night at 10:17, he tweeted this: Republicans should just repeal failing Obamacare now and work on a new health care plan that will start from a clean slate. Dems will join in. That's what he tweeted last night. This morning, he tweeted very different strategy. As I have always said, let Obamacare fail and then come together and do a great health care plan. Stay tuned. Which one do you support? Try to repeal it and come up with a new plan in 2 years, or simply let Obamacare, as the president says, fail and see what happens?
Well, I think that illustrates the fact that we need to let the dust settle a little bit, and some wise heads needs to get together to figure out the direction. What Democrats and Republicans agree upon is that what we have right now is not workable over the long term. It's costing too much. We need to have more accessibility. So I hope that the Democrats will come to the table. I hope that they will participate in the next stage of the solution, because we've got to change it. We've got to have that reform, and Democrats need to be at the table to accomplish that.
So you're with Senator McCain on that. Start from scratch for all practical purposes. Get to work with Democrats. Come up with a bipartisan compromise, if you will, to try to improve the Affordable Care Act, but not necessarily immediately go and repeal it or simply let it die. Is that right?
We've always wanted to have the future direction. I've always advocated that if you're going to repeal it, let us know in the states where we're going so we can plan and there be stability in our delivery of health care. That's very important. Now, I believe that there is a consensus that between Democrats and Republicans that we've got to change things. If that's the case, Democrats should come to the table and say, we will join that effort. I think with that, we can actually accomplish something, and I hope that in Washington they can accomplish that.
Well, Asa Hutchinson is the governor of Arkansas. Democrats say they're more than happy to work with the Republicans. They simply don't want to see the word repeal as part of that process. We'll see what happens next. Governor Asa Hutchinson of Arkansas, thanks as usual for joining us.
Thank you.